He had hemorrhoids on top of ulcerative colitis. We fixed the colitis pretty fast, but then the hemorrhoids flared. That's the story of my latest client to solve ulcerative colitis using the mind-gut immunity method. He also fixes hemorrhoids too. Hey there, it's Dr. Chandu Dasari, and I'm excited to announce several updates to our international coaching program, which has helped people around the globe solve gut inflammation and autoimmune disease over the past decade. If you would like to learn more, visit mgiclinic.com to request a call. We've integrated some new updates for 2025, 2026, and beyond based on some recent published data on ulcerative colitis. These updates will transform your life, so come check us out. In this upcoming video, you'll meet a client from South Africa who was misdiagnosed by his GI doctors, who thought he only had ulcerative colitis. It turns out he did in fact have ulcerative colitis, we fixed that, but he also had internal hemorrhoids, which produce intermittent bleeding. Hemorrhoids cause bleeding especially after physical exertion, sports, and exercise, so getting them addressed was a challenge because his doctor kept blaming his ulcerative colitis even though his fecal calprotectin test was now low and normal. He did not have mucus or cramping. Finding the right probiotic strain was also a big deal for him. Due to the administrative difficulties in South Africa, their mail delivery system was compromised. We had to use some creative solutions to find him the right strains to recalibrate his microbiome. And I also want to point out, we've done this for other clients too who live in remote areas of the world without access to typical infrastructure. If we're able to get these people better, imagine how much easier it is when you have access to better resources. We've had dozens of clients in what would be considered rural and remote parts of Africa solve their inflammatory bowel disease and autoimmune inflammation. There are some great lessons in this one. Let's get started. Hey, Franco, I wanted to sort of talk about the experience with recovery from UC while having hemorrhoids, because I think your case was a little bit tough, right? We were kind of wondering, we were kind of going back and forth, like, why do we still have bleeding, right? When everything else is feeling good and and so I wanted to like kind of, because this problem, actually, I've had 3 clients in the past, I don't know, 3 months with the same exact issue, right? Where, you're getting normal fecal calprotectins, no mucus, but really it's just every so often the exertional bleeding or especially the burning, right? Because you don't really get classic burning symptoms with UC. So I kind of wanted to talk to you about what that experience was like and and just sort of describe it.
Yeah, okay, no, cool, thanks. Yeah, definitely. So I think since I was diagnosed with ulcerative colitis a couple of years back, it's probably not even exactly sure. Time moves so fast. It's probably six years now. I've always been struggling with symptoms like after I'm supposed to be in remission. And I spoke to gastroenterologists about this, and nobody ever really told me that it could be because of hemorrhoids. So for example, you kind of have like this full feeling in your rectum. It's painful. It's irritating. It's like almost like you have there's like something there, but you don't really know what it is. You can't explain it. Sometimes it causes burning sensation. I haven't really had issues with bleeding. The bleeding started, like, I would say, the last year or so. The bleeding started. So I always thought, I was just never in remission. I always thought that there is some information there. Where I think there were stages where I actually was in remission, but due to the hemorrhoids, I thought I was not in remission.
Right, and that's the confusion, right?
Massive confusion. Yeah,
that's the
massive confusion. I mean, that's why I told you before I joined your program that I'm extremely frustrated because through diet and other means I've been able to recover from
the UC.
You see a flare.
Yeah.
And when I get a lot better, like that what I thought was inflammation in my rectum just doesn't want to go away. It's so frustrating. I don't understand it.
And we went back and
like
forth for weeks, probably,
exactly.
I would argue months. By the time,
Exactly.
and then you finally got a fecal calprotectin, and the number was astronomically low. It was so low.
Very low. Yeah, it was 25, which is very low. Yeah.
Yeah, 25.
So yeah, it was 25, which is actually below average. So I think that kind of showed me that, wait a minute, there's something going on here. And then I looked at my previous colonoscopy report, and
You could see it. You could even see it on the picture. Remember, I circled it for you.
Yeah. Like on there's written what do you call it? How do I call the hemorrhoids again? It's stage, or what do you call it? Zero.
Internal, and I think they were stage 1, stage
internal stage 0. Well, do they start? It starts at 0, right, or 1? I can't remember now. Anyways, it's basically it's the lowest one. Like it's not really supposed to be an issue. Stage 1. It's not really supposed to be an issue. I think that's why they never mentioned it, because
they don't always mention it. I've seen so many gastro reports, especially from colonoscopies, and I see it. You can actually physically see the picture with the tiny hemorrhoid there. Okay.
Yeah.
And then the gastros, some of them don't even put it in the report. They definitely don't talk to people about it. And it sort of confuses the picture, because you're like, okay, well, clearly it's there. How are we dealing with this? So it's a very interesting kind of a thing, because so you ended up getting banded, right? For the hemorrhoids, you got them banded. So you did our protocol, which was great. And we'll talk about how that experience was too, like in a little bit. But you got banded. Once you got banded, the bleeding and all the inflammation got better, right? In about 2-3 weeks after that, is that a fair kind of a description?
Yeah. So the bleeding stopped. So the surgeon told me afterwards that I had 4 bleeding hemorrhoids. So
I think you can only have 3, but I guess you had 4.
Well, I can't remember. Like it was
sure.
maybe 3, but I remember.
I do hemorrhoid surgery, so it's.
I remember 4, but
not in South Africa,
Yeah, maybe we are genetically different. I don't know. Anyways, yeah. So after that, the bleeding definitely stopped. However, it was painful. I didn't expect that. Really, really painful. Like for a week. Can't tell you. Wow, that was an experience. I didn't expect that.
It's not. It's just the surgeries and the banding for hemorrhoid. It's not a great. It's not very pleasurable. It's a very painful, because there's a lot of nerve endings there. So it's, of course. And even afterwards, you can have these things come back, even the burning. I give everyone a hemorrhoid cheat sheet. It's a way to decrease hemorrhoids without surgery, and usually that'll fix 80% of people. But in your case, that clearly was not the case. And but yeah, it's very interesting. Like I've recommended a few people in the program go get what are called anorectal exams under anesthesia, or have a colorectal surgeon just take a look and see, and maybe just band grade 1, grade 2s. And in your case, obviously you got better, because that is the primary explanation. When you have a normal calprotectin, when your stools are looking normal, when you're feeling good, then you kind of know the UC is gone, because the UC is like a global. Like the symptoms from UC are very obvious, right? It's like you have malaise, you have dry eye, you have maybe even some joint pain, maybe inability to eat. You feel the inflammation higher up, going up your body, in your belly. You have brain fog, you have fatigue. It's like all of these things are all with the UC symptoms. Hemorrhoids don't have that. Hemorrhoids feel like burning. They feel like itching. They feel like they sometimes bleed, right? Sometimes you'll see clots in the toilet. You'll see the bright red blood. And it's a subtle kind of a thing. And sometimes you can have both, right? There's people with both, which you had. So even after the UC gets better. Hey, I wanted to ask you, so you're in South Africa. I get this question a lot, right? People around the world asking, can we do this protocol from anywhere? And I think I told you, you asked me this question too. And I said, actually, I have a patient. I have several patients in Africa. You're not, or several clients in Africa, right? And they were able to, they were able to go there and get it done. So we did some creative things with the probiotic, right?
Yeah.
But I wanted to ask you kind of what that experience was like, because I know it's been a little bit of a limitation in terms of like, finding the right products, getting stuff shipped, getting things done, finding things in the grocery store, dealing with the infrastructure, shall we say, in mild terms, of the country. Tell me about kind of that whole experience.
All right, cool. Yeah. So, I mean, when I joined the program, you obviously showed me which probiotics I should, source. You gave me a few options from the States as well as from Europe. However, in the meantime, we tried a local one that was kind of similar to
I think it worked pretty good.
well, actually not, but we'll get to that now. Yeah, so I ordered, and it was a bad time. It was like mid-December. It's like the holiday season, Christmas, New Year, all that. So it took like 35 days to get here. It was for me that was very frustrating. I ordered the brand from Germany. So yeah, it took exactly 35 days. Yeah, it was actually stuck at the airport for 3 weeks.
Wow.
And unfortunately, DHL in South Africa is partnered with local post office. They accept the package from the airport and they handle it internally. And the post office is a collapsed organization. Like they are basically bankrupt and completely mismanaged. Yeah, so it took them like 3 weeks, to get to my local town. And after when it arrived, I just received like a report from DHL, like okay, your package has arrived, but it didn't tell me where. So I had to like figure out like where the hell's my package. But yeah, fortunately I found it at the South African post office. I didn't even know that they were handing the package, so only found out afterwards. Yeah, so then fortunately I got a hand on the real stuff. However, the interim probiotic that we used, remember when I joined your program, I was technically in remission.
Yeah.
I had the hemorrhoid symptoms, which I thought was UC, but it ended up being not. So after being like 3-4 weeks with the other probiotic, I relapsed again into a flare. I don't know if you remember that.
Yeah.
So I don't think, although the probiotic was from the same strain,
The difference
I
really.
forget. Yeah. Well, the small difference there. However, we don't really know what the difference is. Like the scientists are still figuring out how these things work. But there was obviously
That's why I'm so
a
specific
difference.
about, that's why I was so specific about choosing these things, because there's a lot, even within strains, within species of probiotics, there can be such a wide difference in terms of how they work. You know what I mean?
Yeah.
And so when you're using kind of like a backup probiotic while you're waiting for the real one to arrive, it's exactly what you said. It's kind of the gamble. And I think, 30, we've never had to wait 35. I mean, 35 days is a long time to wait for things. I think you hold the record. Okay.
Yeah.
You hold the record on that, but it's frustrating.
Go Africa.
Yeah, I know, go Africa. But it's frustrating. It was a very frustrating time because you can see yourself kind of not with the wrong probiotic not doing so well, and then even the same species of probiotic, but not the same patented strains, you can see a big difference. And I think that's I guess that's an important lesson too, I would say.
Yeah, no, definitely. And look, I mean, looking at the real product that I've been using now, from a scientific point of view, just looking at the short chain fatty acids
Fatty
that it
acids.
produces in the colon, that specific mix, provides all three important short chain fatty acids like butyrate and forgot these names.
Acetate.
Where the one,
Mhm.
acetate and propionate, right?
Yeah.
So and the other one that I used, not exactly sure if it was able to
Does all that.
provide all those. And there's obviously another strain in there as well that also has some other mechanism.
Yeah.
So I think it's a very potent mix for like me.
I think some of the
Yeah,
critical features is that it survives
yeah,
gastric acid. It
yeah.
will lay down a biofilm. So the biofilm is like we normally think of biofilms as being a bad thing. But this is a beneficial type biofilm that competes with
Mm,
bacteria. And then you mentioned the white papers, right? You have
yeah.
butyrate, propionate, acetate,
Mm,
these short chain fatty acids. So the probiotic will metabolize fiber, and in the colon, it will
mm,
produce short chain fatty acids. These are called
yeah.
postbiotics. Some people think that by taking postbiotics orally, like taking short chain fatty acids orally, that it's going to get to the colon. That's not how that works.
Doesn't work. I
No,
tried it. Doesn't work.
yeah, they get digested in the stomach and then they get absorbed. They don't get
Exactly.
to the colon. If you
Yeah.
want short chain fatty acids in the colon, you really only have two options. Either one, the bacteria has to make it, or two, you can do an enema, right? Those are pretty much the options. And the reason why short chain fatty acids is so important is because the colonocytes, the cells of the colon of the intestine, that's their fuel. That's what they use as fuel. So that's one of the critical features of, these probiotics. And then I would tell you the other ones are beneficial sucrose metabolism, lactose metabolism, fructose metabolism, right? And then if you look even further down at those white papers, it's decreasing inflammation, it's decreasing visceral hypersensitivity, some
Yeah.
of these inflammatory pathways associated with UC, autoimmune disease. And so, yeah, it's like it's very hard. Like, even if you were to find the same species, which is what we tried for the first 35 days, right? How do you know all of these features are there without seeing the research? And I think that we had a very intellectual discussion about this, right? Back and forth. We're like texting. We're like, we don't really know. We don't know if this.
Yeah. I mean, I was really, because I'm just my nature. I really would like to understand the mechanisms and how these things work, because I myself have a lot of interest in these
Yeah,
things. Also, healthy living, and I mean, I've been on this probiotic bandwagon for a very long time now.
me
That's
too.
actually
Yeah. And
the,
most
the
of them don't
first
work,
time.
right? Most of them don't work really.
Yeah, well, I can talk a lot about this, about my issue. But when I was first diagnosed with this, I wanted to give me all these meds. I went to Science Direct and I just downloaded every single paper I could find, and every single paper it was clear microbiome. Every single paper, spoke about it. Back then, I didn't know much about it, and so the first thing that I took back then was kefir or kefir. I don't know how you
Yeah.
pronounce it in the States.
And then fermented
That actually,
foods. Yeah,
yeah.
other fermented
Well,
foods.
from I tried a lot of fermented foods. Kefir helped me a lot back then. I had the worst issue I ever had was the first time I got it.
Mhm.
It was pretty bad, and kefir actually put me in remission back then.
15
So
years
that,
ago, 15 years
yeah,
ago, when I fixed my condition, I did it the same way you did before we had these
yeah,
patented strains of probiotics.
yeah.
It's very hard to do it that way though. It takes a long time.
Takes
Like
a long
for
time.
me, it took me like 2 whole years with just diet. So I know the diet works
Yeah.
independent of the
Mm.
probiotics, but it's a lot harder, right? Like,
It's very hard. It's not sustainable because it
yeah.
takes a lot of effort to do these things. And for me,
Mhm.
like I'm a vegan. I don't like milk. I hate milk.
Yeah.
And then I have to every single day I have to down this freaking
Yeah.
stinky milk. So for me, like the moment I felt better, I stopped taking it. And that's the thing with probiotics. When you have this condition that I have, you every single day you have to introduce the good stuff.
Yeah.
For some reason, genetically speaking, don't know why. I guess in a couple of years we'll find out. But the moment you have dysbiosis in your gut, that's when the genes kick in, and then that's when inflammation starts. So
Our
your gut has
ancestors,
to be
our
perfect every
ancestors,
single day.
our ancestors used to get this every day, though. So our ancestors used to get daily probiotics, and a lot more like functional strains too. It wasn't like this random stuff. It was like from the
Yeah,
soil, from the fermented foods.
yeah,
So this
yeah.
is why, like, this is like you were the first in your family with this problem, right?
Exactly. First
Even though
one, and only one that I know of.
right, even though it's genetic, it's like right. It's,
I don't know, man. It's yeah. I mean, how this? Why me? Like that's the question. Like,
yeah,
why
why
is
me?
this, impacting me and not somebody else in my family as well? If there's a genetic factor to it.
Yeah,
But I mean, some of the papers that I read definitely show there are some genetic markers.
yeah.
But my personal beliefs about genes, I don't believe like the genes make you sick. Normally, there's a trigger that activates the gene.
Yeah.
And in my case, it's gut dysbiosis by far. I can tell you when a flare is going to come. I know it's going to come because I can feel
Hmm.
I can feel my gut is changing. Like it's gonna sound disgusting, but my stool smells different.
Yeah.
I'm more bloated.
Hmm.
And the moment I reach that point, it's very difficult to
Undo it.
backtrack again.
Yeah.
I'm talking now. I'm talking now before the probiotics. I've not been in that situation again with the probiotics. I hope it's never going to happen again. But
It won't. You get a large range
pre
of
your
freedom.
yeah,
You get
but
a
but but
large
but
range
pre
of.
your program, that's how I knew.
Mhm.
And so that's when I knew for 100% certainty that this is definitely microbiome triggered. There's no question about it. I was just frustrated that I couldn't find like a sustainable recipe from a food and lifestyle point of view because there's so many products on the market. There's so many different fermented foods,
Yeah.
and like you just get so freaking tired with all the fermentations going on all over your house. Like everywhere it's sauerkraut and kefir and then all across the house, and the wife's like, "What the hell is this crap?"
What's going on? Next thing you know, you have like a whole supplement drawer of like or shelf
Yeah, no, exactly. I mean, like
stuff.
my drawer here in my office, it's packed with probiotics. I've literally tried like every freaking one on the market, yeah, so it's frustrating. So for me, the real benefit of this program is you have something that works. If you've tried it on probably I don't know, probably hundreds of
Thousands.
patients,
Yeah.
thousands of patients, so it works and it's easily accessible. Well, not that easy for me, but still I can get it.
I think
And
you were the exception to the rule.
yeah, probably. And obviously, the mentoring, being with you there every single day and just showing the support, that helps a lot.
Thank you. Hey, I was gonna ask, just a few months ago, you were kind of not, you didn't know what you know now, right? If you could tell someone else with inflammatory bowel disease or maybe even autoimmune disease, what advice would you give them? Just knowing what you know now.
Yeah, so I think, today, there's so much information out there with social media on YouTube. There's so much conflicting information out there.
Hmm.
It's really difficult to make sense of all the noise. I mean, you can literally study this topic for months and months, and you'll still be confused. Just apologies for the noise here. If you hear any background noise, the kids are going nuts.
I'm not worried.
It's
We
it's
don't,
it's
by
a
the way,
crazy.
we don't really edit this down at all. We
Okay.
just put
It's
it
it's
up.
a crazy hour before bed, so kids running in the house and cats are meowing and dogs are barking and
Yeah.
Anyways, yeah. So what I'm trying to say is there's so much information out there. It's extremely difficult to find a protocol that's going to work for you if you just do it yourself. Believe me, I've tried many years, and yeah, it's really difficult. So it's good to find a mentor such as yourself, that deal with many clients and they make use of natural methods to bring you to recovery. The meds, it's not the answer. It's not. I've tried that as well. The side effects are absolutely horrendous.
For the medication.
I've medication. I mean, I've only been on the light stuff, mesalamine. That's probably as far as I went. But that alone, for me, was just the side effects. For me personally, it wasn't acceptable. I would rather live with the colitis than live with the side effects.
A lot of people with problems with steroids. They have problems with mesalamine. They certainly have problems.
The steroids are awful. I don't know how people live on those things. Like, I tried that for 6 weeks. It's insane, man. I can't believe people live taking that stuff chronically.
Rough.
I generally feel I'm a very healthy person. I generally feel good, and the moment I take that stuff, I really feel bad. You can't live like that. So what I would say is there is an alternative. There's a natural alternative that works, and just try it. Give it a shot.
You were initially skeptical, and we kind of went back and forth a little while, right? Like,
yeah, well,
we went back and forth a few weeks, maybe. I don't know. How long was that?
Yeah. I was skeptical because there are many programs available currently. It's not only you that they have programs. So, and every single one of them have a different method. The ones that I know about. So I mean, even choosing the right program is difficult. Not even all the programs agree on how to do it. And like I said, I've come a long way with this. I've done my own research for many years. I've experimented on myself for many years. So I was kind of skeptical that you have this this very special probiotic that will solve all your problems.
Turned out to be true. I've tried. Turned out to be true, huh?
It does, because I've spent so much money on different probiotics out there that I was kind of.
Me too.
Yeah,
I kind of so much money on probiotics over the years.
So I actually was convinced that no off-the-shelf probiotic will ever work. I was convinced. But you said otherwise. So
I've had one of the most extensive experiences with precision probiotic therapy to modulate the gut microbiome to actually fix autoimmune diseases. I mean, I've been doing this type of work, I think, for the past 12 years or more clinically, and obviously myself for much longer. But, I was like you, man, like trying all kinds of stuff. And these strains really only came out about 6-7 years ago. So it was a game changer, right? If you looked at like the first 10 years of when I had this, when we've had these conditions, it was like you had to be super strict with your diet. You had to be like you like very restricted. Anytime you kind of did anything different, you'd see a little bit of inflammation or see some problems. It was always like, so the diet works, but it's like what's the other piece of it? And the other piece of it, the missing piece, I think, was precision microbiome therapy. I think that's the cutting edge, and I really think we're still at like the ground level on this. I think we had a lot of discussions about this. Like, eventually people understand what it's going to take to fix these things. But
the thing is, I mean, you're a medical doctor, right? So I mean, you are one of the few who actually have even tried these things, tried like diet, tried probiotics. If you go to the average physician out there, they're not interested. They're not. I mean, even like in South Africa, we actually have a very good private medical system. This side, we have some very good doctors, and I've only met one doctor that said that they know that the microbiome plays a big role, but he prescribed the what is that? It's pretty famous one, man. It's in the first literature on probiotics. they use that one. I forgot the name now. But anyway, it's just
Is it a VSL or VisBiome?
VSL3.
Oh my God, I've seen so many VSL failures. You've tried VSL and it didn't work.
I've tried it as
VSL.
well.
I mean, I've got like tons of clients that are VSL failures, VisBiome failures. I'm like, these don't work, man. They don't.
They sell it under a different brand in South Africa. They call it Vivamix. That's the brand, the European brand that they sell locally. So that's the one that he prescribes to his clients, and he says, no, take this one for life. It's going to help you. I'm pretty sure definitely people with very compromised microbiomes will definitely benefit from it.
Yeah.
But I don't think it will solve your problem. But at least that's a start, right? That's at least a gastroenterologist that's actually trying to
do
think
something
in the right direction. Do something. Like the other guys are just like, what the hell?
What do you do?
We don't believe in this stuff. Just take a salamine, you'll be fine. And yeah, so I mean, congrats to you. You've actually, tried a different avenue, and you found your answer, and you're helping a lot of people. So that's excellent.
Thank you. All right, that's the end. If you think this video will help someone you know, be sure to share the link with them. Leave a comment below discussing your experience dealing with gut inflammation and autoimmune disease and some of the challenges you're facing. Also, if you can follow for more content, it helps this channel reach more viewers. As always, it's Dr. Chanu Dasari with Mind Gut Immunity Clinic, and I'll see you next time.